Welcome to Health Sciences Update. I'm Taryn Roloff, Communications Director for WSU Spokane. Today we're discussing community programs, and we have with us today Spokane Teaching Health Consortium representatives. Joining me first are Traci Couture, Operations Director of the STHC, Spokane Teaching Health Consortium, and Dr. Matt Layton, Board Chair of one of the partners of the consortium, Empire Health Foundation, and a Clinical Associate Professor for the College of Medical Sciences, and a Medical Director in the College of Nursing, both headquartered here on the WSU Spokane campus. So Traci and Dr. Layton, welcome.
Thank you.
Traci, first of all, why don't you explain what the Spokane Teaching Health Consortium is?
The consortium is actually a partnership between Washington State University, Providence Healthcare, and Empire Health Foundation. And the consortium was formed in November of 2013 in order to respond to a grant from the Health Resources Services Administration to create community clinics that provide more access to primary care physicians through residency slots that will increase the primary care pipeline for not only our region, but the 59 other teaching health centers in the country.
So, as you said, there are 3 members of the consortium,
yes,
and Empire Health Foundation being one of them. And Dr. Layton, you are the board chair of
yes.
Empire Health Foundation. So we're really glad that you could join us. You're involved in WSU in very many ways, as I've already mentioned. So this is just such a great thing that you are both with the WSU and on the board chair of the Empire Health Foundation.
Excited to be a part of it, Taryn. It's amazing. One of the things that we found out early on when we started Empire Health Foundation to improve the health of our region, our mission is to make our 7 counties the healthiest region in the state. We found out that mental health is a huge aspect of overall health. And so as a psychiatrist, that was originally the reason that I was asked to be on the board 5 years ago. And one of our main values in trying to improve the health of this region is access to care, which is a huge issue. So for adequate access to care, we have to have enough nurses, enough counselors, enough physician's assistants, nurse practitioners, and physicians, and we don't have enough of any of them. So this consortium and these new residencies provide an opportunity for us to grow desperately needed physicians for our region.
So just to give folks an idea of the discrepancy between what some places have with regard to medical residents, and Spokane. I believe it's, 1,500 medical residents in the Seattle area.
Correct.
And about 85 or so in the Spokane area.
Correct.
Yeah.
Right. So the grant and the opportunity to form this consortium allowed us to grow how many medical residents?
So in the first year, in 2014, we grew 6 additional residents. Providence had prior had 21 of the residents that they were sponsoring, and they received their funding through the Medicare dollars that are afforded for graduate medical education. The HRSA funding is basically, I'd like to think of it as a supplement to the Medicare funding, and it provided for 3 additional residents in the internal medicine residency program and 3 additional residents in the family medicine residency program. So we were very pleased to welcome just last week our second class of 6 residents, again 3 going to the internal medicine residency and 3 going to the family medicine residency. And we also have a new psych residency that Providence is restarting under their sponsorship that brought in 3 new residents.
3 new psychiatry residents.
Why don't you talk a little bit about the need for psychiatry?
It's a desperate need, and where we're looking at retiring psychiatrists and aging through that process, we are short arguably 25 to 50% of the need, and we're growing rapidly. So our population is increasing. What is most important to know is that to become a psychiatrist is 4 years of medical school and then a full 4-year residency. And so these residents, these 3 that have just started, will be graduating in June of 2019. And so what we know from research is that a medical student who goes to school in a region is likely to stay there. But what we know even more is that if they do their residency, they're very likely to stay. And that's what we're trying to do, is develop the whole pipeline, undergraduate through graduate medical education, so we can keep our trained physicians in the region.
All right. So one exciting element of this, in addition to growing the number of medical residents that we have here, is a clinic that WSU Board of Regents approved funding for, and that we actually just started building in the last few months, and it will be done in about a year, by next July, in time for the third class.
What we hope will be the third class of residents. Under the
Okay.
expanded HRSA funding, we are anticipating that there will be enough funding to bring in a third class. That will, of course, be up to the partners, whether or not they want to bring in a third class, but I anticipate that they will.
All right.
But yes, the University District Health Clinic will be opening, we anticipate, I think, May of 2016 for completion, to give us the keys. Hopefully start getting everyone moved in June and start seeing patients there before the third class of residents starts.
So the clinic is actually on the WSU campus, and Dr. Layton, why don't you talk a little bit about the interprofessional aspect of the clinic and the importance of that?
Exactly, and that's one of the most important things about psychiatry at this point is it's more and more integrated into primary care. So we're not so much a marginalized specialty where we have people in private practice off by themselves. Psychiatry residents now are trained to be part of a team. So an interdisciplinary, interprofessional team. So we'll be working with nurses, with allied health, with physician's assistants, and alongside family medicine and internal medicine residents. So we'll be in that clinic. And that's one of the most important things about the Teaching Health Center and the need for collaboration is that a traditional academic medical school or teaching hospital is not eligible for these HRSA funds that we're talking about. That was one of the main drivers for the formation of the consortium within the community was they can be a part of a community consortium, but not the sole sponsor.
And so the traditional sponsor is, as Traci's indicated, Providence in the past.
Yes.
So this is pretty unusual to have WSU, for example, as one of the partners of a teaching health center. Correct?
It's a testament to the Spokane collaborative spirit, I believe, because the need was great, the money was available, it was on a very tight timeline.
Yes, very tight.
And so what we were thrilled to see was that Providence and WSU and Empire Health Foundation rolled up their sleeves, got busy, got the application in, and not only did we get the grant, but now we're being recognized as one of the models nationally.
That's great. In fact, I heard you two speaking before we started about an event you're going to, a conference that you're...
Yeah, we'll be headed in September to the American Association for Teaching Health Centers National Conference. And what's been great is that we've had a lot of congressional support here in our district from our Congresswoman for the continuation of the Teaching Health Center funding, as well as support from our state senators, Maria Cantwell and Senator Patty Murray. And so we'll be doing some advocacy at that conference for 2 days, and then also just getting the opportunity to network with our other teaching health centers and find out what are they doing, what's working, what's not. Bring back some best kept secrets, and hopefully be able to apply them to this beautiful new clinic that we're going to be opening.
And you're right, Congresswoman McMorris Rogers was on this show actually talking about her support for teaching health centers. So we have had amazing support, and I speak from a WSU perspective.
Yes.
Right. So you were talking about, you mentioned some of the programs that will be working with the medical residents, but I wanted to add pharmacy, for example. EWU, Eastern Washington University, will have their occupational and physical therapy folks in the clinic as well. Is that right, Traci?
That is correct. And it seems like every day there's another group that comes forward that says that they want to come and have space in our clinic. So the existing residency program is moving from the building on the Sacred Heart campus at 5th and Brown, which is just on the lower South Hill. It's an older building. They're running out of space as we're trying to grow the residencies. They're running out of space, and so this new clinic is going to be great space for them to be able to work interdisciplinary with pharmacy, with PT and OT. I've heard rumors that speech and hearing would like to be involved. I had a chance to talk with Don Seidel from the Autism Center, and they would love to come in and talk with us about what opportunities there are to partner. And so I think what this is really bringing out is everyone just out of the box thinking, how can we make this work, and how can we provide the best care for our patients in just one location?
Right, so you mentioned the involvement of other groups. So the Medical Legal Partnership is one of them that I believe is going to be there,
Yes.
Providing not only medical care but legal advice.
And Better Health Together will be there, providing in-person assister for those who need access to insurance or maybe underinsured, helping them navigate that very complicated process.
Better Health Together is a subsidiary of Empire Health Foundation, and we started that with an agreement with the state as part of the health benefit exchange.
Right.
And so we originally were contracted to provide 10,000 new enrollees. We are now at 84,000 and counting.
Wow.
So we've far surpassed. It's been going great. And the whole idea of the in-person assister is that you have someone who has a need. Perhaps they have health problems, mental health problems, and they often don't know how to navigate the system.
Mm-hmm.
And so this in-person assister actually walk them through this system so they can get the benefits they're entitled to.
Mm-hmm. Just going back again to what you said, Traci, some folks may not understand that the clinic that we're referring to that's coming from the Fifth and Brown building over to the new one being built on our campus actually sees patients.
Yes.
Thousands. Many thousands.
35,000 patients last year between
Right.
the internal medicine residency and the family medicine residency.
Right. So to be clear, that's the service we'll be providing through this
And
partnership.
education integrated right with it. And that's another one of the values of Empire Health Foundation is education.
Mm-hmm.
And so you mentioned I have my fingers in a lot of pies.
Uh-huh.
I have the pleasure of teaching behavioral medicine, not just to medical students and residents, but also the dental students. You mentioned
Mm-hmm.
EWU and the RIDE program, the physician's assistant students in the MEDEX, the University of Washington MEDEX program. I get to teach nurses, social workers, and so what we know is that the reason that the team works is we all have our strengths. We're taking care of the one individual with these complex needs that permeate all of our specialties. So that's an exciting thing to be happening right here in Spokane.
Absolutely. Well, have we missed anything? Because I want to really give credit to Providence and Empire Health Foundation and the consortium for coming together on this project with WSU.
I think it's going to be great, and I'm excited to see what the future brings.
Yeah.
I am too, and I think that the whole goal of Empire Health Foundation is to measure what we do and have metrics to try to determine. We don't just write checks. And so one of the things we're doing with the new philanthropy center, which we just had the grand opening on Monday, is we've moved from philanthropy 1.0, which is just writing checks and hoping for good outcomes, through philanthropy 2.0, which is collaboration, to now the point where we're actually leveraging all sorts of funds from large endowments, from foundations around the country, extramural grant funding, and so we are a partner, and this is what we're seeing is that partnership and collaboration become a reality.
Well, you know, you mentioned the 3.0. I went onto your website and I saw that and I thought, wonder what that means. So
it really is an idea that just writing checks does not move the dial. It doesn't move the needle on the gauge. And what we've found is that the largest organizations, whether it's Robert Woods Johnson or the Gates Foundation, Ford, we work closely with them. And in fact, our president, Anthony Chang, is on the board of Grant Makers in Health, which is all of those foundations from around the country, and trying to figure out how to get the best outcomes when you have money. And what it says is you need partnerships. You need to align your goals, your objectives. That way everyone can be rowing their oar on the boat and going in the same direction instead of going in circles.
Very good. All right. Well, we are going straight forward and it's very exciting. So
Yes.
Thank you very much for being here, both of you.
Thank you for the opportunity. Thank you.
Yeah. And thank you for joining us on this edition of Health Sciences Update.